can't get a line. Somebody get me the Easy IO. Okay, I need to put a line into your leg. I'm going to put it actually into the bone. We can't get a line on you, an IV line, okay?
Who needs an IO? Intraosseous access is indicated in adults anytime in which vascular access is difficult to obtain in emergent, urgent, or medically necessary cases, and can be established utilizing the proximal humerus, proximal tibia, and distal tibia sites. IO is indicated in pediatric emergency patients anytime in which vascular access is difficult, and can be established utilizing the proximal tibia and distal tibia site. The proximal humerus can be used in patients when the landmarks can clearly be identified and IO is indicated. Examples of patients who could benefit from IO access include, but are not limited to, patients with limited or no vascular access, or who require multiple IV sticks, such as diabetes, end-stage renal disease, cancer, cardiovascular diseases, HIV/AIDS, multiple sclerosis, hemophilia, cystic fibrosis, rheumatoid arthritis, Crohn's disease, ulcerative colitis, COPD, drug abuse and addiction, as well as major trauma, cardiac or respiratory arrest, sepsis, or excessive tissue, creating difficult vascular access. The following are contraindications for easy IO access: a fracture on the targeted bone, previous orthopedic procedures near the insertion site, a prosthetic limb or joint. IO has been used within the past 24 hours on the targeted bone, infection at the insertion site, or an inability to locate landmarks or excessive tissue.
Okay, now I'll let you know before I'm going to put it in, okay? I'm just finding the spot where I'm going to put it. Are you ready?
Mm-hmm.
Okay, quick poke. Ready? 1, 2, 3. Okay. How was that?
That's all right.
Doing okay?
Mm-hmm.
This is the medication. It's going to make it numb, okay? So it's going to make it numb in there. As I'm putting it in, if I'm going too fast, if there's too much pain, let me know and I'll just slow down, okay? Here we go. Let me know if I'm going too fast. How are you doing?
Fine.
On a scale of 1 to 10, what's your pain?
2.
Okay. And now?
Maybe like a 3.
Okay. And now?
3.
Okay. Still doing okay?
Mm-hmm.
What's your pain level at now?
It's going down. 2.
Okay. Now again, we're just going to go slowly here. Doing okay?
Mm-hmm.
Still doing okay? What's your pain level on a scale of 1 to 10?
Like a 4.
Okay. All right, now this next flush needs to go in pretty quick. Okay, it's going to take me about 5 seconds. So I'm just going to count down with you. You're going to feel some pressure and some stinging pain when I do that. And then I'm going to be done in 5 seconds, okay? Are you ready?
Yes.
Okay. 1, 2, 3, 4, 5. Okay? All right. What's your pain level right now?
Like a 4.
Okay. So I'm still going to I'm going to give you a little more lidocaine to manage that pain. Doing okay still? What's your pain level?
Like a 3.
I'm just going to let the IV push that medication in a little bit. Doing okay still? Scale of 1 to 10, what's your pain at?
Like a 1.
All right. How are you doing on the pain? Okay.
Still a 1.
1 still?
Mhm.
Okay. What's it at now?
1.
Okay. Still a 1?
Mhm.
Okay. All right, I'm just going to check that and make sure I don't have any fluid leaking around it. Great. Now the last thing is just to put the wristband on. This just lets everyone else in the hospital know that you've got an IO in place. All right, there you go. You did great. Okay, Kelly, we're ready to get this out, okay? Okay, all I'm going to do is I'm going to twist and pull this straight up while I'm taking it out, okay? Ready? And you're all done. Okay, we'll just get that wristband off you. All right. Good job. Okay, so Karen, we were not able to get IV access, so what we're going to do is we're going to get vascular access by putting it into the bone. So what you're going to feel is it feels a lot like an IV when it's going in. You're going to feel a little bit of pressure when it's going into the bone, and then I'm going to give you some medication once it's in there that's going to help to numb that area up so you won't feel anything after that, okay?
Okay.
So are you allergic to any medications?
Just penicillin.
Penicillin. Have you ever had lidocaine before?
Not that I'm aware of.
Okay, all right.
When you're ready to place the needle, remove the Easy IO driver from the case and remove the trigger guard if present. Select the appropriate needle set and inspect the packaging for damage. Prepare the Easy Connect tubing that comes with the needle set. If the patient is responsive to pain, consider 2% lidocaine without preservatives or epinephrine, also known as cardiac lidocaine, for anesthesia prior to your initial saline flush. Once your Easy Connect is primed, clean the insertion site according to your institutional policy for aseptic procedures. Next, identify the site. The proximal humerus insertion site is located directly on the most prominent aspect of the greater tubercle. Ensure that the patient's hand is resting on the abdomen and that the elbow is adducted or close to the body. Slide your thumb up the interior shaft of the humerus until you feel the greater tubercle. This is the surgical neck. Depending on patient anatomy, approximately 1 centimeter above the surgical neck is the insertion site. VitaCare recommends the 45 millimeter needle on patients weighing more than 40 kilograms. The humerus is the preferred site for patients who are responsive to pain. Once the insertion is completed, secure the arm in place to prevent movement and accidental dislodgement of the IO catheter. The proximal tibia insertion site is approximately 2 centimeters below the patella and approximately 2 centimeters medial to the tibial tuberosity, depending on patient anatomy. The insertion sites for pediatric patients are the same as those for adults. In small children, generally under the age of 2, the tibial tuberosity may be difficult or impossible to locate. If the tibial tuberosity cannot be palpated, locate the distal aspect of the patella. Move approximately 2 centimeters distally, depending on patient anatomy, and then medial to the flat aspect of the tibia. The distal tibia insertion site is located approximately 3 centimeters proximal to the most prominent aspect of the medial malleolus, depending on patient anatomy. Place one finger directly over the medial malleolus. Move approximately 3 centimeters proximally and palpate the interior and posterior borders of the tibia to ensure the targeted insertion site is on the flat center aspect of the bone. Thank you for watching this training presentation. For more information, please visit www.vitacare.com.